In today's world, cardiac care associates can optimize access, quality, and patient satisfaction, and we may forget that from time to time, but we're talking here about PAs and NPs as part of the new care delivery model. And as part of our coverage of this particular meeting, the CV Summit, I am with course co-director Michael Valentine, MD, who is from the Centra Health in Lynchburg, Virginia.
Correct.
And thank you very much, first off. This is a spectacular meeting. And we're talking here about some of the younger docs and their role in this new world. What's the news?
Well, the younger docs, obviously, we have been targeting younger physicians, FITs, and also early career docs. But in the team-based care model that you're talking about with NPs and PAs, what we're really talking is cardiac care associates, those who are helping us in the workforce of team-based care. As we try to manage chronic disease, recurrent disease, try to prevent readmissions, our team-based care with the use of CCAs, with nurse practitioners and PAs, is going to be critical in the future. We really see them as partners, and the college sees them as partners, and obviously Jim Dove was instrumental in making them a part of the college many years ago. But you can see, as we talked about in one of our breakout sessions here at the summit, that increasing access, improving quality, and improving patient and provider satisfaction is critical. And NPs and PAs, the CCAs, have been instrumental in helping us achieve that. And as we look at workforce shortages of the cardiologists and the growing and aging population, the team-based care with CCAs is going to be critical to excellent management.
So in the new healthcare model, does it really support this whole concept that it kind of promotes it a little bit more?
Absolutely. We ask our members here of the college that are attending the summit, we ask them how many of you are using CCAs in your team-based care, and the number that we see this year from 5 years ago when we started our first type of this meeting 5 and 6 years ago, there's been a dramatic increase. I think that once physicians realized that we needed partners in the team-based care management, it has been a tremendous benefit. There's no doubt that the rise of team-based care, the number of NPs and PAs working in practices is growing. In fact, I asked yesterday, you may have been there when I asked, what ratio do you see of physicians to mid-level providers of CCAs? At part, it was 3-to-1, some 2-to-1, some even had 1-to-1 in their practice. So it's a growing part of team-based care, which is critical to managing our more complex patients.
I'm sure it's different at every facility, but what is the right number, or how do you determine that?
There is no right base number. Obviously, the three things that you mentioned that are critical are, number one, access to care. So if you can't get patients worked into your practice for weeks and you are overburdened in the hospital, then obviously you have a shortage of manpower. This is where the NPs, the PAs, the CCAs come in, to be such an important part of management. In our practice, we use them in so many different ways, as you saw yesterday in our workshop. They're able to run our heart failure clinics, they run our device clinics, they help us run our urgent clinics, which means patients can get in any day at any time with a specific cardiac complaint. So many other services in all of medicine, including primary care, have difficulty getting those patients seen on an urgent basis. So the access to care improves the quality and improves the management of chronic and acute disease.
You may think that you're doing well with your use of these associates, but how can you really tell? How do you sit down at the beginning of a year like we are at now and go, how can we do this better?
In the team-based care model, you not only have to include CCAs in the day-to-day management, but you also have to put them on your strategic planning process, and you have to look at the future. You have to look at your data. And, the last session that we did on the summit was all about your data, whether it's Pinnacle Network or whether it's NCDR or any type of data that you're gathering. You have to be able to know how far out it is that you're able to get patients in, how quickly, what your demands are, what your quality numbers are, all that data, and then you can look in strategic planning and try to figure out how many more people do we need to help us support this. This is going to be population-based care before long. It's not going to be just individual. We're talking about the value instead of volume. And as we go to a value-based management, then things like patient satisfaction, outcomes, and quality of care are going to matter, and then the team-based care becomes even more important.
And you're not too small to be thinking about this, because I was talking to David May, and he was saying that there is a place for small practices, and even the small practices like his needs to be doing strategic planning, and definitely don't forget to, instead of making it from on high, get everyone associated with this somewhere along the line involved in that whole process.
As you mentioned, our CCAs are not only on our committees, but they're on our executive committee. And so when we're planning to make changes in the future, we're involving the CCAs directly, as we are our nurses and our whole care team. This is no longer a physician-dictated process. This has to be the team-based process. And if you're not planning, as somebody said earlier, if you're doing strategic planning without your nurses, without your CCAs, then you're really missing half of your care team, and perhaps the most important part.
Well, please check out some of the other interviews we've done from the CV Summit, because we have a lot of material here. If you weren't able to make it to Las Vegas, it's online. It will be in print. Cardiosaurus World News. I'm Executive Editor Rick McGuire.